All right. Hello and welcome. This is our Friday book club, and today we're talking about what is your responsibility in a healthy relationship. This is something that I have seen over and over again with my clients where they have questions about, is this my responsibility? Are these feelings or needs my responsibility, or is it theirs? And if you grow up in an environment where the adults weren't taking responsibility for the things that adults are supposed to take responsibility for, then you may feel really confused about it when it comes to parenting or relationships. And this can be even with partnerships. This is where, like, I just got off a call with a couple, and there was an arguing thing going back and forth, and neither one of them were really taking responsibility for themselves, for what was happening for them. So we pulled it all apart and started looking at, this is your responsibility. Oh, this is your responsibility. And by the end of the session, they were both like, they both were breathing again and like, oh, right. Yes, I can still care about this person and not take on what's really theirs. And, in this particular, couple, the wife had all kinds of things that were coming up from her childhood that were showing up in their relationship. And so she was mad at him because he wasn't responding in the way that she needed. And then he had stuff coming up. And so both of them were in their own worlds with stuff going on, not able to really see each other, but also not taking responsibility for what was theirs. And so that's what we're talking about, whether we're talking about parenting young kids or whether we're talking about older kids, teens, or whether we're talking about a relationships with other adults. How do we know it's ours? How do we know it's our responsibility? How do we know if we should be to put ourselves in weird positions trying to take care of somebody else? Is that our job? Is that our responsibility? And when are we overextending? When are we taking responsibility away from someone else that actually needs that responsibility to grow? Because I see this thing that happens in our society where we have not enough responsibility taken for young kids. We expect way too much out of young children. We expect them to regulate. We expect them to be together. We expect them to have their feelings organized and to be able to follow through with things that we're telling them, this is your responsibility. And then we're not giving them enough support. And then when our kids are older, where they should be taking on more responsibility, many parents continue micromanaging and not giving enough space for that development to happen. And so it's important for us to recognize that we kind of invert it in our Western culture. Not enough support when they're little, a little bit too much micromanaging as they get big. Our kids need way more support when they're little. And if that didn't happen for you, that may not be, or your partner, that may not be how that happens, what that shows up as. It may show up as, no, they're three, they're big, they should be able to, manage this on their own when they really can't. So, that's what we're going to talk about today. That's why it's important. We need to be able to kind of look at it and pull apart. What we're going to be doing is that the first 30 minutes, I'm going to be giving information and sharing resources and giving us some guidelines, some ways that we can look at it and figure out if it's ours or if it's somebody else's. And then kind of looking at development. Where is this other person? And also, what's their capacity? Are they capable of taking on what we think that they should be able to take on? And then the last 30 minutes, we have a discussion that you can ask anything you want. We stop recording. So that is your time where it's not on the record. And so if you've got questions or something specific that you want to talk about, then that's the opportunity for you to do that. I want to introduce myself, and then Shruti is here as my amazing layer of support. I'm so grateful for Shruti for being here for the book club for us. So my name is Rebecca Thompson Hitt, and I am the founder and executive director of the Consciously Parenting Project, which I started 18 years ago. And I am Really interested in relationships. I think I've been studying relationships my entire life. Definitely have gone down the pathway of taking on things that are totally not my responsibility. Have a lot of personal experience with this particular topic. And I've been untangling that for a long time because I grew up in a family where things that weren't my responsibility, I took on. And some of them were things that were put on me, and some were there was a vacuum and no one was doing them. And so I took them on. And so I spend my days pretty much every single day working with people in their relationships. And I'm trained as a holistic marriage and family therapist, and my other passion is pre and perinatal somatic psychology. And so how that shows up in the body, what the other stories are that we're experiencing. And I'm the author of 4 books. And this book series is based on It's Never Too Late to Heal, which is my 4th book. So, which I don't have with me because I'm traveling. So I'm in a place with a horse on the wall. And yeah, I mean, it's a well done horse. I mean, I'm impressed. I like horses. I used to draw them when I was young. I loved horses. So this is kind of fun. I was just talking about that like last week, and then this horse shows up. So I am here with Shruti. So Shruti, would you introduce yourself and tell us a little bit about you?
Yeah. Hi, everyone. I'm Shruti, and I'm a psychotherapist, and I've trained in a variety of modalities, uh, pre and perinatal psychology, body-mind psychotherapy, family constellation. I'm also a body worker, so a sacral therapy, and a host of others. So prompted me in this direction, that is to choose this as my life's work, was my own life's journey and the personal work that I did, like Rebecca mentioned, right? That's a big part of, I think, most people who come into this profession. You detangle your own life, and then you realize how it changes your experience of life. And when that happened to me, I just wanted to pass that forward. That's how I came into this line of work. And yeah, I love every bit of it. So
Thank you. Thank you,
yeah,
Shruti.
thank
And
you.
Shruti completed my 2 year training in the 3rd year as well. And so she's well versed in my work as well. So it's lovely to have you here.
Yes, absolutely. Sorry, I missed that part.
We're working together, mutual support and cooperation here. So, so I have my slides, and so I'm just going to take a look. Actually, I'm going to share this particular one. Um, and let's see if I can. I think I can't. I have to share it first. Okay, so I tried to do the thing where I go full screen with it, but I can't do that until after I have shared it. So, current slide. Okay, so what belongs to you? And actually, I had this little card you could make. It's a piece of paper, and you just fold it, and on one side you write belongs to me. And so you can say, okay, am I upset? Am I having strong feelings? Is my body having a reaction to the situation, to the person, to the words, to the vibe? Am I on red on the brain stoplight? Do I have a strong urge to fix the situation? Do I want to run away, fight, or shut down? And if you're answering yes to any of these questions, it belongs to you. That's yours. And then it's your responsibility to take care of those feelings, those needs, whatever it is that's coming up for you from your past that this situation is reminding you of. Whatever is coming up in this relationship, that part is yours. So if you look around and you're the one upset, it belongs to you. It's oversimplified, but it's also super helpful. It's like, right, I'm upset. There's something here that belongs to me that I need to take care of. And often it comes up as you did this or you didn't do that. And so it's much easier to look on the outside and say, oh, it's your fault. But this is okay, as you're pointing this way, turn the finger back around at yourself. What's yours here? Because you cannot control another person. But you can take a look at what's happening for you. Does that make sense, Shruti? Yeah. All right. Okay. So then this part is what belongs to somebody else. And this is really important, this other piece, when the other person is a capable adult. So we're going to talk more about kids in just a minute and look at development and then also look at when people actually aren't capable because that's a whole other situation where normally it would be their responsibility, but sometimes, and you've got to evaluate it on a case by case situation, sometimes it is your responsibility. So, if you look around and the other person is upset, they are having strong feelings. Their body is having a reaction to the situation, to the person, to the words, to the vibe. They are on red on the brain stoplight. They are trying to fix it. That's actually what just happened in my last session, where the husband kept jumping in and trying to fix it. And it's like, okay, that part belongs to you. Or if they want to run away or fight or shut down, or they have run away, or they are fighting, or they have shut down. That belongs to them. And again, we're talking about a capable adult. We're not talking about a child because that's a different situation. But with another capable adult, it is their responsibility to take care of themselves and whatever is coming up for them in the relationship. And once that has been looked at, then you can come back together as two adults. And this can be siblings, this can be your parent. And, now that you're an adult, adult relationships. It can be relationships with friends, it can be relationships with your neighbor, like anybody. Just beginning to notice who's upset. For me, I learned this about 20 years ago, maybe a little bit more. And it was really revolutionary to me to understand that, like, yeah, they were upset and that was theirs because I grew up thinking they're upset, that's my responsibility. They're upset, I need to fix that. They're upset, I probably did something. So it's my responsibility to comfort, to whatever. And this is from being a child with my parents. So that role reversal that I was talking about, where, children aren't getting the care that they need when they're young, but sometimes those children are taking care of the adults. So just naming some of the tangly stuff that happens in all of this. When the other person is not a capable adult, we're just going to start with, like, if they're under 3, across the board, there's not really a question. They're not capable of being responsible. Stay close, help them regulate. They can't regulate their feelings, especially if they're big feelings on their own. And so it is your responsibility, not theirs. Now, as children grow, they're capable of taking on a little bit more responsibility for their needs, for their feelings, but it is still primarily your job as parent, well beyond 3. It's not like, oh, great, you're 3. Something just happened with your hippocampus. And so, now you're good. The brain doesn't actually finish developing until you're at least in your 20s. And I just saw a statistic that was talking about how if you are on the spectrum, that it may not finish developing even as a female until much closer to 30 than they originally thought. There's a lot of stuff we don't understand. That's a picture of me I just found when I was visiting my parents this week. I'm very excited about that one. So, when you are evaluating this, is it my responsibility? Is it someone else's responsibility? The first question is this other person a child? I mean, look at little me. You know, okay, I was pretty capable. I want to give you that. But she's not very old. She's not capable of being responsible for everything. So if you look over and the other person is a child, the majority of the responsibility is going to be on you. So young children require an adult to support co-regulation. As they grow, you can see their capacity increase with that support. Otherwise, it's just compensation. They're just looking like they're holding it together, but they're not really capable of being regulated, of being responsible for all of their needs and all of their feelings. So as we get to more of the preteen and younger teens, they still need support, but they are able to take on more responsibility emotionally for their emotions, for their needs. And there, it is still primarily your responsibility to track. Where are they? Where are they in their development? Where are they getting stuck? Because there's so much that happens in the brain in that time period that even kids who seemed like they had it more together when they were a little bit younger, more of that like 8, 9-year-old range, everything rearranges in the brain during this puberty period. And so they may need you more in different ways than they did before. And so it's tracking that, noticing. And some kids have a much harder time with that than others. So noticing that. Older teens, and when I'm talking about older teens, most of the time I'm thinking of like a 16-year-old or older. There's something about 13, 14, 15 that is still in that younger teen. They still need a lot of support. 16, and it depends on the child. So it's not like all right, I'm sorry, Rebecca said you're 16 now, so it's your responsibility. But they're capable of taking on much, much more of that responsibility. And that's the part that we need to be able to separate out a little bit and say, okay, yeah, you're the one who's having the big feelings here. And maybe I can be with you. Maybe I can support. I'm going to check in with myself and see what I need here, which I think we should be doing all along anyway. But giving them even more of that space to discover what is it that they're needing? What is it that they're feeling? And if they need support, to come to you and you being open for that. And I watch as children in healthy relationships develop, they get further and further out, but still kind of coming back in, touching in, going out, touching back in. Okay, got a little overwhelmed out here, but it just gets further and further apart. But they still need you. And if you think about your own experience of being an older teen or a young adult, maybe you remember needing more than you got. I find that that's pretty true across the board with most of the people that I talk to, is that, wow, I really needed a little bit of extra support. I really needed somebody who was a mature, responsible adult who was available for me. And there wasn't anyone. And so I just had to figure it out myself. It's like the trial by fire. So when our kids get to these developmental ages and stages, we don't know how to support them either because we didn't get it. So it gets super confusing again. Is this my responsibility? Is this your responsibility? And a lot of the parents that I see tend to overcompensate and take more responsibility. Like if their child is having a hard day, it's like, all right, well, I got to figure this out. And it's like, no, actually, you don't. Actually, they need the space, but they need to know you're still there. And that's a very different thing. So it's this negotiation that happens as they get older. So, how do you navigate that? And also depending upon your child and their capacity. A lot of the families that I'm working with right now have older teens or young adults who are on the spectrum. And so they have other needs. They may need more scaffolding, more support for a longer period of time. So that's part of what I'm talking about, the capacity. Are they capable? Because sometimes they're not. I mean, I've got some clients who are older 20s who have special needs and they're still not capable, but they're scaffolding and they're getting there. So we have to be responsive. And I think that that's one of the most important words that I have learned in my own parenting is responsive. How can we be responsive to the child we actually have rather than like the framework of this is what it's supposed to look like. I'm sorry, you're this age, you have to be able to do this. But if they can't, then we need to step back in and support. That's part of our responsibility as a parent. It's tracking and being responsive. So when the other person is not a capable adult, we need to take responsibility. Are you modeling taking responsibility? Wow, I got really upset there. I'm going to go take care of myself right now. And then I'm going to come back and then we can resume this conversation because I really want this to go well and I want our needs to be met here. Or, wow, I really didn't handle that well. I am so sorry that I yelled. I don't want to yell at you. That doesn't feel good to me. I know it doesn't feel good to you. So taking responsibility is how our children learn how to take responsibility. So if you have an older child or a teen who isn't able to take responsibility, the first question that I always ask is, have they seen it modeled for them? Do they know what that looks like to take responsibility? And so when you take responsibility as they're growing, then they learn how to take responsibility. And it's really important that we don't continue to take on responsibility when it is no longer our responsibility. So it's both and. It's they need to see it. And as they grow, we still need to be taking responsibility for what belongs to us. But if they're the one who's really upset, they're the one who's having a hard time, they're the one who made a choice and they're a young adult, then we can be there with them. It might look like that without us taking it on. It's like, you got a speeding ticket. And then the parent is like, okay, well, I'm just going to pay it, and I'll take care of it. It is now my responsibility when it's theirs. And that's a lesson that they need to learn, right? So, all right, we're going to play a little game. I was hoping to get pictures, but I didn't. So, a couple is fighting. Each person is blaming the other person. Who needs to take responsibility here? And if you want to type in the chat, you can type in the chat. Both. Yes. Each person needs to take responsibility. Okay. So a parent with an older teen has been upset a lot. So the parent is upset. The teen isn't doing the dishes as agreed. The parent is yelling at them. Whose responsibility is it? So it's kind of a trick question. Yep. And Shruti, given they're both blaming each other, both again, although the parent should initiate. Yes. Thank you, Meredith. Nice work. Yes. The parent for their feeling and the teen for the dishes. Yes, exactly. So separating out whose responsibility is what. The teen needs to take care of the dishes. The parent needs to take care of their feelings. And then the parent needs to initiate what's going on. They need to take care of themselves first and not just blame the child. A toddler is losing it in the cereal aisle at the grocery store. I've been there. How about you? Whose responsibility is it? The parent. Yes. Okay. A 7-year-old left a huge mess in the living room and didn't clean it up. Whose responsibility is it? She's screaming that she doesn't know how to do it. Whose responsibility is it? Right. The parent, although they can work with the kiddo. Yes, because we need to be scaffolding those skills. And that's how that child will learn to take responsibility. It brings it back into the child's growing edge. So great. All right, last one. Your 85-year-old father is unable to care for himself and insists on continuing to drive. Whose responsibility is it? Ooh, this one is hard. Hard. And some of it may be very dependent on the situation. There may be someone else whose responsibility it is, but it's recognizing that, okay, he's not capable, and then asking the question, is this my responsibility? Is there somebody else? Is your 85-year-old father living in an assisted living already? And so it may be the responsibility of where he's living. But ask the question, be curious. Yeah. Okay, that was the game. So this is kind of our recap. Many of us learn to take responsibility for things that weren't our responsibility. And we may not have had responsibility taken for us that was appropriate for us. We need to take responsibility for small children and support them by modeling taking responsibility. I'm sorry, I didn't see what you needed. I can try to meet that need now. It's not about always getting it right, but it's just recognizing there was a need. I didn't meet it and naming it or having your own need. Wow, I really needed to eat something. I started doing this with my kids when they were pretty young. I'm really having a hard time right now. I think I need to eat something. I think that might help me feel better. And just naming what's happening, what I'm doing, so that and then they started doing the same thing, which was amazing. Wow, I'm really having a hard time. I think I need to eat something. And then they would go get themselves some food or ask for help. So, as our children grow, we need to give them more opportunities to take responsibility without forcing it on them. We need to continue modeling and track when they're ready for more and not taking responsibility for them. We can name that we aren't taking responsibility for their decisions. We can also name that we're here if they need us. And then we get to decide what we're willing to do or not willing to do. Okay, you got a ticket. You have no money. I will pay this ticket, and then you're going to pay me back by doing jobs around the house. So it's that scaffolding of responsibility. It's not, okay, well, I just took care of it for you. So, with other adults, we are each responsible for ourselves, for our own needs and our feelings. And if the other person isn't competent, we need to evaluate what our responsibility is in that situation. And that's it. Okay. So, I'm going to stop recording and we will come back again next week. I think I want to do something about tracking your own needs and what you can do to take care of yourself. So, see you next week.